really been looking forward to today's discussion, where hopefully we're going to have a broad discussion about medical equipment and innovation in general. But really, the one of the innovations that we're going to spotlight is a product called Dignity Lifts. Okay, and a lot of times people ask me, they say, geez, Steve, where do you get all these speakers and topics and things like that? And sometimes they come to me. I get emails from all of you in the audience, and it's like, hey, you should have a talk on this or that. But sometimes I'm just sort of out there floating around social media and LinkedIn. And I have to say, when I saw a demo, and I think it was a video on LinkedIn of Dignity Lifts, and based on all the questions and comments we get whenever we talk about aging in place of medical equipment, I was like, I have got to track this company down and see if we can do a discussion around it. And so I am charged up. Oh yeah, Saleem is here. This is awesome. So here, unmute yourself, Saleem. I'm
Hi, Steve, Tom.
Hey, yeah, and Tom, you can jump on camera here. And but before we dive into Dignity Lifts, Saleem, I didn't know that you had logged in, and so I was gonna do a little commercial for New Hampshire Medical Supply, which is, if you're in the DMV, the Baltimore, Washington, Mid-Atlantic area, this company has been around for 60 years, probably the oldest medical supply company in the region. And Saleem has taken it over. I was at his DC location the other day, and he is working hard on sort of creating an IKEA experience in the medical supply space. How's that going, Saleem?
It's going pretty well. There are 2 locations underway in DC, and our plan is to bite the bullet and go with a really large size showroom. My team is a little freaked out right now, actually.
I know what it's like to have people that work for you that freak out with, I probably all 3 of us who are, whenever you are an entrepreneur, you usually have a steady stream of ideas that really can wreak havoc with your advisors. But it's exciting when things go right, and it's exciting when you have to modify a little bit as well. And Saleem, let's you are I believe when I met Tom and I was talking to him about Dignity Lifts, when I mentioned your name, he's like, oh yeah, Saleem is a supporter of what we do. And Tom, let's, well, first off, Saleem, sorry, I cut you off. I kind of gave an intro because I wasn't sure if you were going to pop on, but tell us a little bit about, though, New Hampshire Medical Supply, and then we'll get to know, and yourself, and then we'll get to know Tom, and we'll get a demo of Dignity Lifts. And then folks, if you've got any questions about medical supply, equipment, reimbursement, things of that nature, we got 2 guys on here that can probably answer those questions. But Saleem, yeah, give us a little bit about your background.
Yeah, sure. So, I mean, my personal background, I'm a pharmacist by training, and then, we are from pharmacies. Now we are doing the medical supply side, which is as clinical as running a pharmacy. The New Hampshire, yeah, I mean, Steve mentioned that 61 years. The primary, which we call it mothership, actually, is on a New Hampshire Avenue, although larger and fancier showrooms have gotten built, and they are being built. By the end of this year, we will, knock on wood, probably we'll have 8 locations actually in the DC area.
Wow. All right.
Yeah, so we are going in hospital-based systems also. But one message, I mean, this is where I'm telling my team, and they are actually more advocate than I am in some cases, very proud. Restore your lifestyle. This is it. So this is the message, So we just want to be on every stage where we can restore a patient's lifestyle. And it just concludes the whole case.
I love it. All right. Well, that's a great segue to Tom, because let's face it. I mean, if you can't take care of yourself in the bathroom, that is, it wreaks havoc on your self-esteem. And and when I saw what you had created, I really think it's a next level step to the traditional elevated, toilet seat that we've all seen out there. But Tom, give us a little bit about your background and what led you into creating this unique product.
Sure. I want to compliment Saleem about something. I don't know if he knows this, but we launched our product. We launched it online. You could order them online, and we tried to do some press releases to the press. But our real coming out party was at a trade show called MedTrade in Arizona. And, it's a big thing for us. We had the lifts and we just demonstrating it. I was very nervous, had written some good sized checks and was, pretty nervous. And Saleem and his wife came by the booth, and I can't remember if they were the first ones, but I'm going to tell a story like it was. But I believe they were the first dealer to place an order with us, and they did so without hesitation. And that is a vote of confidence I will never forget. So Saleem, I really wanted to say thanks for that. It was a big moment for us. Introducing a new product is a nerve-wracking thing. And now that I've said that, I'll introduce our product. I'll give you a quick demo, and then hopefully some questions will come up about like who's buying these things, why are they buying them, and we have a lot of conversations here with the customers and their concerns and their needs. And I do a lot of trade shows where I talk to OTs and PTs and ATPs, and we're really learning a lot about people's bathroom needs in the future. So Dignity Lifts makes toilet lifts, and I'm going to show you them right now. The other day I was giving a demonstration, and when I walked back here, someone said, "Oh, I thought that was a fancy background." This is what we call our Zoom room. It's sort of like a little trade show in the back corner of the office. And so toilet lifts are an assistive device. They replace your toilet seat, and they go up and down both directions. So this is our most popular model. It's sleek and easy to use. It has a control under your right thumb, and takes about 20 seconds to lower you all the way down and 20 seconds to raise you all the way up. This device is popular because it's sleek and easy to clean. It also runs on a rechargeable battery. Now, I know what you're thinking, Steve. Why would I need a cordless toilet lift? Seems like a strange option. And the answer is that a lot of people don't have an outlet near their toilet in their bathroom. Also, if you're going to the bathroom, you want to do so whether the power's out or the power's not out. So the rechargeable battery is a very popular feature. I'd say about half our customers need the lift installed right away. And that calling an electrician and having an outlet installed is not usually an option. So, and then, you just press the button simply and it goes up and down. This particular model is popular. It works with both round and elongated toilets, and it adjusts for different toilet heights. Most people don't know this, but there are different toilet heights. Now that I'm telling you this, you'll probably realize that the next time you go to the bathroom in like a hospital or a handicap stall, and those ADA compliant toilets are 18 inches tall, and then they're 16 inches tall, which is probably what most people have in their home. And if you have an older home, sometimes you have a lower 14-inch toilet, which is like getting a free squatty potty device if you have a 14-inch toilet.
Yeah, and I think they call the term these days for is right height toilets is what some of the folks are talking about. But again, I'm glad you brought up, Tom, that your clients need these immediately. It's sort of like, okay, if you didn't get a right height toilet installed in your house and you're coming home from the hospital, you need something. And
Right. And the term right height is weird because, there's a very large variance in the height of people. So, someone who's 5 feet tall, if you put them on an 18-inch toilet, their legs are going to fall asleep sitting there. And that's a common complaint with a raised toilet seat, is that the person gets numbness in their legs, which is not something you want in our client base. The bathroom falls are already too sky high. And the other thing about, I don't know if you've seen the commercial for the squatty potty or you know what this is, but it's a platform you put under your feet, and it become very popular because it helps you evacuate. And a raise, what it does is it basically squats you more, squatty potty.
Mhm.
And the opposite is true as well. If you squat less, you have a more difficult time evacuating. It just doesn't straighten out the canal which you use to evacuate. So having a toilet lift where you get all the way down to where the toilet seat used to be and get all the way up is a big advantage over a raised toilet seat or a taller toilet where you're just sort of sitting on this tall throne. So the next time you go to and you end up on an 18-inch toilet, whether it's a handicap stall or in a hospital or any kind of facility, and you're struggling, you can remember that the guy from Dignity Lifts reminded you why that is.
Yeah, we got a question from Dennis, but I got a question for you as well. But Dennis says, what's the weight capacity of your products?
Yeah, a great question, Dennis. This particular model, our deluxe lift, is a 300-pound capacity. And we have a couple other models. This commercial model is 350-pound capacity. There's also there's concern with the customers, and rightly so, about width. Now, see, when you design toilet lifts for a living, I guess that's kind of what I do. I engineer toilet lifts. The building code for some homes is the toilet nook is supposed to be 24 inches wide. So that means there's 12 inches from the center to either side to a wall or a bathtub or a vanity or something like that. So if you want to fit in the most homes, you can only make your toilet lift 24 inches wide. And that's what this model and this model are. That leaves you with arms, and then you have about 19.5 inches between the arms. That's the same as most office chairs. So we have a width issue as well as a weight issue. So if you want to fit into standard homes, then you have to be fairly narrow. So not when people get to that 300-pound area, we also ask them to be sure they're going to fit into the lift. Because if you don't fit in, you're not going to be able to use it.
Now the commercial one looks a little bit wider.
It is. And that's because a lot of people, we initially called it the industrial model, but people were buying it for their home and then having trouble with it not fitting. But it's really made for like rehab facilities, independent living and assisted living facilities to use. Its big advantage is it's on wheels, so it can move from residence room to residence room, as someone might have had a fall or come back from surgery and they need to use this temporarily for a week or two.
Wow.
So that, because those facilities have ADA compliant toilet heights and they have wider bathrooms with more space, we could build a wider toilet lift for them. So 350-pound capacity on this one.
Hey, and my question for you, as you are just elaborating on evacuation and toilets and this, that, and the other, what did you do before you invented this? And did you ever imagine that you were going to become the expert on evacuation?
Right. And I didn't invent the toilet lift, so I won't take credit for that. But I am an engineer. I have a master's degree in mechanical engineering. And I'm going to tell you what I did prior to this, and you'll just shake your head. I actually created and ran and then sold a bulletproof vest company. So I was in the bulletproof vest business for about a dozen years. Before that, I started an online company that sold like embarrassing medical supplies, like enemas and Depends undergarments, enemas, adult diapers, hemorrhoid products, and that type of thing. So I dabbled in this sort of market, not so much on the aging side of it, but more in the personal care side. And before that, I was an automotive engineer. And before that, I was a helicopter engineer.
Wow. Wow.
Yeah.
And,
The
and
reason I got,
you're based out of Michigan, correct?
yeah, we're in the Detroit area. Yep, that's correct.
Excellent.
And the company that runs Dignity Lifts I created 24 years ago. But Dignity, when we sold the Bulletproof Vest company, I kept 3 employees, and we were all out of work. So we were like, what are we going to do next? And they were looking to me. So I read some great books. It takes a while to sell a company. So I had about 18 months to sort of figure out what the next step was going to be.
I love it.
Yeah. And I looked into longevity, and I wanted to get into this market. I went to trade shows around the world and looked for products that would help elders in this country that maybe we didn't have. And I saw a few things. Some of those things have come to market. Like one of the products we considered doing was these sleek rollators from Scandinavia.
Yep.
You know, yeah, like everyone is coming out with these carbon fiber, and they're super cool looking rollators. I saw those over in Scandinavia. Toilet lifts are popular there as well. And but we decided that we'd go with the toilet because other people may not want to. And I think I was right, because nobody, other people have brought in those cool looking rollators and have left us alone in the toilet lift business.
Yeah, and you can find those cool looking carbon fiber rollators at New Hampshire Medical Supply.
Sure can.
Saleem, what do you? I'd love for you to share your opinion on the toilet lifts in this country, and also from your customer perspective, any thoughts that you have?
Well, first of all, medical supply, this is a sore subject because, again, with my background on the, and Steve, like I came from a forensics background. There was a different background I used to have. But anyways, we are all coming from interesting backgrounds. But pharmacy and medical supply, these are the two very hardcore, deep experiences I have working and owning those businesses. Pharmaceutical research has really gone to the Mars. We are developing fantastic products when it comes to biologics, injectables, and all that. Medical supply is just embarrassing that we are in the Stone Ages. And I do not know why. And I'm spending probably the rest of my life to maybe make an impact on this thing. Because it's really, really, like Tom mentioned, why? A toilet seat, and he's absolutely right. Frankly speaking, I'm not a cardiologist, but on a clinical side, it can, a little stress can very easily initiate a cardiac episode. And that's why, like cardiologists give stool softeners, because, at a certain heart rate, you do not want to, put the pressure. So it's not a joke, it's a serious matter.
I mean, really, basically the two things that I think that come to mind when I think about medical supplies are the archaic wheelchairs that are out there. They've looked the same, and I think they are the same as, the 1960s, the general wheelchair that's out there for public consumption. And then the plastic, things that the donut that you stick on a toilet seat. And that's why when I saw what you were doing, Tom, I was like, this makes perfect sense. And I love your design because it appears that all three of the products can be moved and taken away from the toilet very easily if they needed to be.
Yeah, well, the commercial lift is on lockable wheels, so that one's very mobile. The other is really just pinned to the toilet. You adjust them to the right height. Okay. So they're meant to. The main goal is stability. I mean, we have to provide these users. They're having trouble standing up, so you have to provide them stability. But they're not meant to permanently install. They install in minutes. It really is easy as taking off your toilet seat and putting on another one in a way. So. Yeah, we knew that people don't want to buy a new toilet or do any of this work. So, and they need a hand. So happy to help.
One comment I would like to make, when one thing Tom did so beautifully is that which is a very difficult thing. It's very easy to say that, but when I touched this product the first time, actually, this is a funny thing. You remember, I was with Sarah. Yeah, my wife was with me, and I was touching this product. It's sleek, it's stylish, but is designed for functionality. This thing is tough. You can build a tank over a toilet, which looks like a tank, But again, the point is that, you have to keep the aesthetics and, like the experience in mind. I do not know, you can make a comment, but that was probably the toughest thing in the part of engineering when you dealt with it, most likely.
Yeah, this is a piece of someone's home. This is not, it's going to become part of their home and one of the more intimate parts of their home. So it really has to look nice. Now we make a basic toilet lift, which is this one over to on my right. And that one, some of the linkages are visible and the actuators are visible. The goal was to make it more affordable. So the deluxe lift, the one that's most popular, is $14.99, so $1,500, and the basic lift is $9.99. And you would think, under most circumstances, that the less expensive one would be a better seller, but it's not even close. The sleeker, more modern looking one with just a few more features outsells the other one 10 to 1.
Yeah.
It doesn't lose power either, by the way.
Right.
Because, we have it in our showroom, it can be experienced. It does not lose power.
Right. Like the rechargeable battery that it uses lasts about a month between charges. So you only have to charge it about once a month.
And I love this comment from Kelly. She says, not everyone who might use this item is old or terribly ill. Great for people with knee and hip replacements. Kelly, thank you for saying that. At some point in this discussion, I would remind folks, because so often when we talk about medical equipment and stuff, it's sort of, oh, this is all the stuff for old people. But yeah, going an athletic injury, rehab, there's people of all ages that have mobility problems. And again, the beauty of this is that if you do have a loved one that's going through rehab, and this is something you're going to use at least every day, if not multiple times, but it's also something that when you get better, it could be passed on to or resold. What's the resale market like, Tom? I know you don't like to talk about that, but
we don't know much about it, to be honest.
Okay, all right.
We've been around for 2 years. Once in a while, someone will call, and we generally, it's tough to resell a toilet seat. I mean,
I know it is, but look at me.
We generally recommend they donate the product to the local council on aging,
or to like a rehab center. I mean, right. I think this would be fantastic. But let's see. Dennis asks, where's the plug in the recharge so it's easy for somebody to connect?
Sure. Dennis says 2 ways you can recharge the battery. One way, you can take the battery out. So it comes out right here. So, oops, when you pull it out, it stops going out. You take the battery out and bring it to the charger, or there's a plug on the back, which is an easy place to access. Even though it seems like there's still, the toilet tank will be right here. So there's plenty of access to the back side where you would plug it in. The other thing is the charger will float charge the battery, sort of like leaving your phone or your laptop plugged in. It's a lithium ion battery. So you can just leave it plugged in if you do happen to have an outlet near the toilet.
Okay. About how long will the charge last if you didn't charge it?
So it will last about a month between charges, about 300 cycles. So and about a month between charges, and it takes 4 hours to recharge it.
Great.
Most of the time, the lift is doing, like, the battery is doing nothing. The lift just sits.
Yeah, no, that's great. Joanne Lynn says, a raised toilet seat with arms would not fit in my bathroom. A raised toilet seat had to be set up without arms. I live in an apartment built in the 1950s. And,
yeah, it gets narrow, huh? This is very tricky. These are tricky setups. It's different, all these strange configurations. we see toilets that were stuck in a closet, like,
Yeah.
someone can no longer climb. Usually someone can't climb the stairs any longer. So they turn an old dining room and an old den into a bedroom, and then they need to find a bathroom nearby because they can't go upstairs for the toilet. And they put a toilet someplace unusual. It can be difficult. In those cases, usually you're talking about someone that's a, sort of more severe case in some ways. And both the commercial lift and the deluxe lift come with a commode, bucket, and a rack, so they can be used at the bedside as well.
Oh,
So
wow.
if needed, that's something we provide as well.
So Saleem, so let's pretend that we're focusing on Joanne, who is sort of like, she's got this narrow space, and she really wants to stay at home, but wants to make it easier to utilize the toilet. What are the other choices for someone like Jolynn if she didn't have the space to do the dignity lift?
Yeah, sounds like Joanne is in DC area. I mean, no one has a space in DC. That's a sarcastic joke.
Yeah.
But if not, I can speak on behalf of a few programs actually, at least in the DC and Maryland area. The state government, after some qualification test, they do have programs which are considered waiver programs. And what those programs does, that they sort of pays for mild construction, meaning is that extension and movement of a sink, and creating a permanent resolution for this problem. That's one thing. That would be very unfortunate. I mean, if dignity is not going to fit, then the other choices are just basically those, pieces of plastic, which are raised toilet seats, I would say.
Yeah, and what one of the programs which we featured on your discussion is the Safe at Home DC.
Safe
program.
at Home is one program. There is a PACE program, PACE.
We're going to have those guys on next month as well.
Oh, really? Okay, so we are their one of their suppliers, for PACE. So they'll be using us for their needs. The DC government directly has a waiver program. So the state, the District of Columbia has it, and Maryland government has it too. So this is basically their fund, which they call it a waiver program. Meaning is that for special cases, they will go out of tradition and cover these needs.
Now, I'm glad you brought up reimbursement programs. Tom, what is it like? I mean, I imagine getting a product approved like yours to qualify for Medicare, Medicaid as a medical equipment is, like moving heaven and earth. So this is primarily a private pay product, correct?
Right. And I think people want to know the immediate answer. The immediate answer is that Medicare does not cover toileting items at all. So when we went to them with this product, it's no surprise that they don't cover it. There's incredibly rare cases where they will cover an electrically lifting bedside commode. This is Medicare. And there's a bunch of requirements, and for that process, it seems quite rare for that to happen. I did talk to a customer today that managed to get approval for that. And then, Medicaid programs differ state to state, and there are programs to keep people in their home. I know Chicago just launched a program where they're trying to keep people, Medicaid is trying to keep people in their homes, because if someone ends up in a Medicaid facility, it's going to cost them a lot. And that usually is the driver for the purchase of our product. If you can't toilet yourself, you're usually going to end up in assisted living. And whether you're going to pay for assisted living out of your own pocket, which most people will have to, or Medicaid's going to pay for it, or the VA is going to pay for it, it's cheaper to keep those people happy in their home. They want to be in their home. They're more comfortable in their home. It's less disruptive in their home. But if you can't go to the bathroom on your own, that's round the clock care you're going to require. So
Yeah.
so that's really where we fit in.
But I could see where, like with the Safe at Home, or I've put a few other links in there, self-directed care, like there may be a situation, folks, where you can qualify for these programs, and part of that could be used to get something like Dignity Lift in there. You've seen stuff like that happen, Saleem, where depending on the person's situation, a specific piece of medical equipment that might not be necessarily approved by Medicare, Medicaid could be afforded under one of these programs?
Yes, we have seen this a lot, and obviously I might be biased, but DC has fantastic programs. You know, I mean, from government to nonprofit. These people, my personal experience, like us, they are emotionally attached with the profession and the beneficiaries. And we do work in Virginia, and there is nothing, you know, against Virginia, Maryland, but my connection mostly is in DC, and I have seen that, you know, I mean, they really go above and beyond.
Okay, we got a few more questions here. Dennis asks, for people who are paraplegic that need a slide board to transfer from the wheelchair, does the armrest lift need to access the seat?
Right. It's a great question. And we can talk about the use case for that type of patient. Toilet lifts aren't for every single person. I'll start with that. Generally, you know, this is for most of our customers are somewhat ambulatory. They're walker rollator users. They're just getting stuck in a seat. They're the same type of people that use a lift chair. They can usually move about when they're standing, but they can't get to the standing position. So let's talk about wheelchair users and what they need. I think our friend understands a transfer board. So that's a horizontal transfer. You would go from your chair to your toilet, and that makes perfect sense. But there's no lift required. So so a toilet lift is generally not the best choice, and for someone who is wheelchair bound, unless their wheelchair height is an unusually high wheelchair and they need to be lifted up to that. But usually you can buy like a toilevator, which is a riser that you put under your toilet to make it that height. So in general, we don't need to be like lifting up people, like standing them up for that purpose when we could horizontally transfer them. So I had a conversation. I was at the International Seating Symposium, which is like the big wheelchair trade show, and a PT, a physical therapist, asked me like, "Oh, what do you do about wheelchair, you know, patients?" And I can understand. And one of our lifts does have some movable arms. And I said, well, why are you standing that person up? You know, like why in that situation are and she said, "Oh, I just stand them up because I'm a physical therapist." You know, so I thought that was good that she sort of was in a friendly way admitted maybe she should consider that might be a better horizontal transfer.
Yeah, no, and I'm really glad, Dennis, for that question and
Me too.
for your response, because you can really see where your target customer is probably that person that has a wheelchair, or I mean, has a walker or a rollator, and the ability to get seated properly and get up again. Your product is a lifesaver because it manually goes up and down versus just a static seat that you, even if it's not squatting down much, you're still having to utilize that muscle strength.
Right. You know who's a good advocate of our product, which you wouldn't expect, is EMTs, firefighters, and police officers, because the number of calls they get of people who are stuck on the toilet. Like, I wish I could give them all a business card throughout the country, and they could, you know, every time someone gets stuck for the first time, they could say, "You should consider getting this product," because they stay quite busy, you know, getting people off the toilet. It's unfortunate.
Yeah, and I can only imagine that is not the greatest visit for any emergency professional.
And not an inexpensive visit either for the resident, because they have to gain entry into your house and they probably are going to do it in a hurry. So that usually can mean some repairs after the fact.
And when you did that, I just basically looked up on Google, and there's an article that I'll share with everybody. Firefighters ask people to stop calling 908. It says 650. This is in the UK. Since 2016, more than 650 people have had to be rescued from locked toilets. Yeah, gosh, in public spaces too. If
Oh yeah, right.
and you're getting stuck there. Okay, let's see. Okay, Ann says Medicare pays 100% for bedside commode 3-in-1 in Texas. These have arms and are adjustable and can fit over a commode.
Yeah, I think Ann is correct, but they pay 100% for the most basic stationary commode. So if your person can't stand, that's not really going to do them any good, you know. So
I can make a comment on this.
Yeah,
I mean, that would
absolutely.
be injustice if I did not. So Medicare, I can elaborate that. Medicare does not pay 100% on anything, by the way. If you see 100%, it means that there is a secondary insurance, which was
and Ann elaborated
Yeah.
on that.
Yeah.
okay. So that's one thing, but they do pay. Yeah, 3-in-1 commode, bedside. They do value this one. The issue comes down to, unfortunately, is the extensive requirements of those documentations, which in some cases, they become impractical for the beneficiary and the supplier, and for the prescriber. So because when we start collecting the documents, a lot of times our prescribers, they get frustrated because they're very busy taking care of their patients. And sometimes the requirements are slightly silly, but I obviously cannot, make a comment on government policies.
Saleem, this is a really good again, another thread that I think is of great interest is that, again, because we've got this culture of I'm not going to pay for anything healthcare, oftentimes, let's say that we have an accident or we need rehab and we need medical equipment, our first thing is, it's like, well, what does my insurance cover? What is Medicare? What is Medicare? And they probably visit your store, right? And they're focused on what can they get without spending a penny. And I imagine, because you both just kind of alluded to it, is what our plans generally cover is very basic and might not even be adequate for most of us. Is that correct, Saleem?
That is absolutely correct. And then, again, could be biased, but I think, Dignity Lift, it's very reasonable. Seriously.
Well, that's what I'm kind of saying. Like this is something that you're going to use every day. You might be using it every day for the rest of your life, but even if you're going through rehab, it's sort of, you're using a product like this every day. And what did you say the deluxe version was?
$14.99.
Yeah, so $1,500, let's say rounded up, is divided by per use. It's pretty affordable to live in dignity and to minimize the chance that you're going to end up back in the hospital.
Right.
Saleem, are there some other examples of like products that we should be thinking about? Like, so for example, let's say that I need a wheelchair or a walker. What's sort of the difference between what I get for Medicare and what I could go and purchase that, or is there another example other than the Dignity Lift that we might be thinking about if we have a client or a loved one that needs medical equipment?
Yeah, so in depending on the product category, I would say, if I'm making my professional comment, some product category to start with, they are applicable for a general ailments and they are sufficient. like the starting point, I mean, so I would not like immediately discount the effort of government. If they are paying, for a wheelchair, for example, yes, they start with a basic wheelchair. But the important part, what I would try to mention here is that, I mean, go with the best fit. And this should be the priority. I do understand that it's easy to spend someone else's money.
Yeah.
And I get it. But still, I mean, the problems which can be long-term with the wrong fit, if government is okaying a 18-inch wheelchair, we come across this thing a lot, actually, where a person is not exceeding the weight limit. Like, for example, I mean, Tom designed the product because he obviously studied the weight limits commonly. So the weight limit is under a certain weight, but the width of that person is slightly wider. There are people who retain more girth sometimes, in the hips area. Female are more common than men, in this case, morphologically. Now, the problem is that government is not going to pay for something which is wider, especially made, but they can pay the difference. Government do allow that.
Oh, okay.
Of course.
Okay. So like, for example, let's say that my mom needs a toilet lift and, oh, no, toilet lift would not be an example because that's not covered, but something that is covered, like, is a walker or a wheelchair covered? Okay.
Mhm.
So I could go to a supplier like yours and sort of use that as credit, but then upgrade to a more appropriate wheelchair or walker.
Absolutely. And
Okay.
there are obviously the supplier needs to be very knowledgeable because interestingly, government still wants to be part of this. So they did not make it very simple. We have to tell the government that you are paying this much and this person is not accepting what you are paying for 100%. There is a series of documentation which we have to report. And then we can credit, ask for the difference and we can do an upgrade in majority of the cases.
And one thing that Saleem brought up is the most important thing is the fit, which I think, to speak to Dignity Lifts, the fact that you've created something that can be customized and it can go up and down because it moves is wonderful. But I dropped into chat a discussion that we did on medical equipment, one size doesn't fit all, and actually that was with I believe the OT that is with New Hampshire Medical Supply, correct? Yeah. And Tom, you sort of hinted to in the beginning, talking about the medical professionals that really embrace Dignity Lifts. Can you speak to that a little bit?
Sure. I could talk about the evolution of our customer. When you start out and you have something new, it's difficult to reach everybody you think will use the product. But right away, the first people that were buying our product were people who really, really did not want to move out of their homes. So, and we're really interested in learning about our customers. So one way we would look at them is we know their address because we're shipping a lift to them. So we would look up their home on Google Maps just to see, like, where does this person live? Are they urban? Are they in Washington, D.C.? Are they apartment? Are they at assisted living, independent living, or is it a house? And the first customers we saw were houses. And you'd see a lot of houses on a lake, and you'd see a lot of houses on 100 acres, and you'd see a lot of houses, that were 5,000 square feet. And you could tell that this person was in danger of moving to assisted living, and they were going to have to give up all of that. Or they were going to have to hire around the clock care, which is also unaffordable. So that was the early pull for our product. You get the pull, and then you get the things that you can push. The push for us, the push that we're learning to do more and more of, is we're working with occupational therapists. They're in charge of your ADLs, your activities of daily living. They're the ones that are interested in the person's toileting abilities, their toileting needs. And we like to work with the OTs. First of all, they're always really friendly. And second of all, they make good decisions for their clients, because sometimes people think a toilet lift is going to solve their problem, or they don't know a toilet lift exists. And we can help the people that may not know it exists. And some of the people that think it might solve their problem, it might not actually solve their problem. So reaching out to the OTs, and of course, building a dealer network where people can see the product, come in and, try it out, and the OTs can see it as well. OTs, PTs, and ATPs. So yeah, that's where we sit.
That's excellent. And I am blown away at how, like, prior to doing these discussions, I assumed that OT's primary function was in a rehab center, where they have the kitchen set up and all of that stuff. And what I'm discovering more and more is how many OTs are making home visits, are reviewing the environment, the actual environment, not some fake, kitchen or bathroom. And what an amazing resource. Saleem, do you see the same thing with the OTs?
We see the same thing with OTs. Yes, absolutely. And it's basically the especially working in an urban kind of environment, we come across a lot of those professionals. And that's basically, the OTs, PTs, and then OTA also, who are the assistants for the OTs. That's another fantastic, actually, crowd of people who are helping a lot of patients.
Excellent. I'm dropping into the chat for those that are in Maryland. There's a Maryland Durable Equipment Reuse Program. There's also Kathleen shared that there's a nonprofit in New York City where people donate medical equipment. And, I bet you that I can only imagine how excited somebody would be if they found a Dignity lift at one of these reuse programs. But I think that's that's actually kind of a cool campaign, not just for you, for your company, Tom, but for all medical equipment companies. Because how many times have you visited a friend and you look in their garage and they've got, all this, walkers, wheelchairs, stuff from their grandmother or whatever have you. People need to know that there's folks out there that, need equipment, might not have the funding, and it's a great way to clean out the clutter of your house.
Right.
Okay, man. Well, I can't believe this. Well, I guess I can believe this because this is a topic that I'm personally interested in, and I know it's really important, but we're getting close to the top of the hour. So any sort of additional thoughts, like Saleem, out of curiosity, because you've got this laboratory where you've got people coming in and out of your business and making orders every day. What is the most popular item that people start with at New Hampshire Medical Supply?
Rollators.
And what we should do is let's schedule a discussion specifically on rollators. But I'm just kind of curious. I know from our previous discussion, having the right fit is the most important thing with a rollator. But is there anything else that folks should have in mind? And folks, I'm going to drop in Saleem's website, so if you do have any questions, you can reach out to them.
Yeah, rollators are very common because if someone is using a walking cane, they can easily move to the rollator because they don't have to wait for any debilitation. It's a nice looking product. In some cases, it looks more attractive than the walking cane, and it's very safer. It's much safer than the walking cane. So rollators is one thing, definitely. But for the bathroom safety part, I would say that if we, like this IKEA, what you were saying, and we will get there one day. I'm not quitting, so there will be an IKEA soon enough. if I line up the items in a bathroom, then I would say that Tom's product probably going to be number one. I'm just going to point out 5 or 6 things, but basically number one is Tom's product, and particularly this product. It's really a fantastic product.
What was the other product?
Well, so number one would be Tom's product.
Yeah,
that's one, which is a bifunctionality. It's a raised toilet seat. Grab bars are important. Then shower benches, because it's the risk is the toilet and the risk is the tub. These are the 2 most risky areas, and the rest is basically a transit in and out. So if if we think about the schematics of a bathroom, so shower is dangerous and toilet is dangerous. So Tom got one thing covered, which is the toilet part. And then we are talking about the shower benches or potentially shower chair.
Yeah.
I would say.
As an engineer, I'm really looking hard at the showering process and I'm racking my brain trying to come up with a great solution to get people in and out of the shower safely. And goodness gracious, what a mess.
Well, if there's one person that I'm confident in, it's going to be you. But I think, we just talked. I think the real engineering problem there is something that we talked about today. It's sort of, you've designed this, to accommodate the traditional household bathroom. But as we saw with one of our questions, it's sort of like, well, I got one of those closet bathrooms, but when you think about tubs and showers and glass and no glass,
the variety is
that,
so great. The variety is unbelievable. And Saleem will probably tell you that the shower benches and the wall-mounted shower chairs, and there's just a bunch of different ones, and they're really all different because they're designed for different situations.
Yeah.
And the home modification groups that are installing these, zero entry showers, they have to look for something to put in, and there's a lot going on there, and maybe we'll come up with a solution that 30% of the people love and 70% of the people can't use. But there's something needs to be done. Saleem's absolutely right. It's a very dangerous spot, and people deserve to have some independence, or just, the transition from being able to shower and bathe to sponge bath is just a miserable time.
Oh God, my heart breaks for folks, but reaching out to the 2 of you, you can make the experience a little bit better, whether it's temporary or long-term. So now, so for Dignity Lifts, folks, you can, Saleem is a dealer of these, so folks can if you're in the DC, Maryland, Mid-Atlantic area, you can touch base with Saleem, but you can also go to the website and order directly from Dignity Lifts as well, right, Tom?
Yeah, and that's correct. If you want to see it and touch it, and you're in DC, Saleem, we have dealers around the country too. And you'll find those dealers on DignityLifts.com.
Yep, and I've shared that website, and I'll have it with the recording. Well, folks, this has been another great discussion, and I'm really glad we recorded this, because I know there's going to be a lot of folks who are going to be in a crisis situation, and they're going to stumble into this, a month from now. So that's exciting. But I'll make sure to share all of the contact information for Saleem and Tom, and thank you, both of you, and thanks to the folks that participated today. Great questions and great comments.
Thank you very much, Steve. Yeah,
thank you.
Thanks for having us.
We'll see you guys.
Thanks, Saleem and Steve. Steve, you're really good at this. I enjoy all of the broadcasts. I'm happy to be part of it.